second. I'm gonna go live on the other one. Okay, I think we are live. Hello, everybody. Hello. Welcome to our National Native HIV/AIDS Day Awareness Instagram Live session. I am here with my fabulous colleague, Chris Paisano. Chris, why don't you introduce yourself real quick?
Hi, everybody. My name is Chris Paisano. I am the Indian Country Coordinator here for Escalate Program. I am from the Navajo Nation and from Laguna Pueblo. So, Yate, Guatemala to everybody out there.
Awesome. So we're bringing everybody here today. Thank you, Chris, so much for joining us. And we're gathering here today just to reflect on National Native HIV/AIDS Awareness Day and really just how HIV/AIDS, sort of the specific impacts to the Native community, which my colleague can speak a lot about as one of the coordinators of the Escalate program. Chris, could you talk a little bit about that?
Sure. I mean, one of the things I love about Escalate is that it actually addresses stigma, specifically HIV related stigma. So, Escalate is a 5-day program and it is meant for all of our Brian White HIV/AIDS programs to look deeper into why there is stigma, why is there HIV stigma, with the idea of that if our clients can feel free and welcome in all of our programs and to get the medication, then of course they'll live healthier lives, and hopefully that their viral levels will be at zero, undetectable, and that's a good thing because then their lives will be healthier, and we will all be healthier in that sense.
Exactly. And at the end of the day, it's about the healthier whole human family, right?
Exactly.
So we only have a few questions today. This is going to be pretty quick, around 15 minutes, just to give an overview into, again, National Native HIV/AIDS Awareness Day. And we're going to be discussing some of these similar themes at the 2024 Biomedical HIV Prevention Summit, which will have an Alaska Native plenary that is focused on, similar themes that we're going to discuss today.
Exactly.
Before I get all the way started, I just wanted to share a quick message from the CDC. When you know, the only way you can find out your HIV status is to get tested. HIV self-test can provide results in as little as 20 minutes, and no matter your test results, you have options. To learn more, go to cdc.gov/HIV self-testing.
Exactly.
Right.
Know your status. Know your status.
You ready to get started?
I'm ready.
Okay, so we have a lot of HIV/AIDS awareness days. What does National Native HIV/AIDS Day Awareness Day mean to you?
For me, and I hopefully for the rest of my family, is that it gives us an opportunity to really speak on the issue to so many other people who may not be in the field of HIV prevention, because HIV prevention and HIV health is common for all. The H stands for human, so we're all involved in this. And one of our trainers, Dr. Moetan, says we are all HIV possible. So with that in mind, for me, this is a great opportunity when I walk out this door back on the Navajo Nation to really talk about HIV prevention and just to talk about HIV. It's something that is still very stigmatized here in very urban areas, rural areas on the Navajo Nation, and I assume in other Native communities as well. So for me, it's a way for us to talk about HIV prevention in a safe way, in a loving way, and an embracing way.
That safety is of the utmost important because it's just such a sensitive topic. So, what are some of the challenges that are unique to the Indigenous population that we're encountering and trying to uplift on this Awareness Day?
I think two. One, if you're especially living in a large rural area, the resources are not readily available. I'm lucky that I live a mile away from a very major hospital run by our native people, our Navajo Nation. For some other people, though, who live outside, going and making an appointment, and then hopefully you'll find transportation, somebody will take you and there to get seen. And unfortunately, they've got a lot of stringent rules. If you happen to be 15 minutes late, they will cancel you, and then you have to go into the queue and try to get another appointment as well. So access is very strong. I mean, whether you live a mile away or 10 miles away, if you can't make it to your provider, then that's a major barrier to get access of care, whether that's HIV, whether that's also anything else, all the different health challenges that all of our community members face. The other thing I would suggest is, of course, stigma is a big one. And not only within those who are needing to get treated for HIV, living with HIV, but also for, because we have smaller communities, what happens is that a lot of our people don't feel comfortable going to their local clinic, and they will travel
They
hours
might
and
know
miles.
somebody, or somebody might know somebody.
Exactly. And so what happens is that then they will travel a longer ways just to get it. So access is not readily available as it would be in larger urban areas.
Oh, okay. Um, so you just mentioned access, so that goes right into my next question. What can we do to impact that accessibility and make sure that not only the healthcare services are accessible, but like education and resources to combat stigma? How can we make sure those are more accessible for Indigenous communities?
Well, one, of course, is to take Escalate. We welcome all of our providers to take Escalate. But I think also what is very interesting is that for our health providers, they too are carrying their own baggage into the clinics as well. And so that also feeds down into the providers, nurses, those everyday people who take care of folks in the clinic. So the fact that we have many people who don't want to go to our local clinics speaks volumes of the stigma that's there. One of the things I think culturally is that when we get doctors and people who aren't from the community, and even community itself, who have stigma and don't want to talk about HIV, they, they'll take a training and they think that this one training, I know how to deal with all Native people because I took the training, but to recognize that all of our communities, Native communities, are not the same. And a good analogy I always like to bring out is that Europe is sort of like us as well. We have different languages, different cultures, different experiences. So that, say, you were in Norway and you took a class, that would not be applicable to anybody if you went moving down to Italy. Different culture, different language. And so
Exactly.
sometimes I we
That's a great analogy.
yeah, and sometimes we are painted as Native people, as we're all this one group, and we're not. And so having that understanding that we're all different and challenged, you know, speaks volumes to being open to different cultures and how your clients will be in each different areas.
Yeah. And could you share? So, again, you work directly with a lot of what you were just talking about through your work in the Escalate program. Can you share like some success stories in, maybe increasing access, or maybe, an education success story, a stigma combating success story?
I have two actually. The first one
Please do.
we just had an Escalate training last week in Albuquerque, and we invite while it was Native focused, we invited other Ryan White clinics to come. We had one from Pocan, from the state of Washington, in Seattle, and it was very great to hear that they understood that their client base, while it didn't really address Native populations, they recognized that Native people were in Seattle. They recognize they need to do a better job to outreach to Native people. And they also recognize that they knew that their messaging has to be different. So they came in with open eyes and wanting to learn and to speak more with the Native participants who were there. So that was like the first time I've ever heard anybody really feel about that. And so just having a wider lens to
That's
have
fantastic.
experience. Yeah, I mean, it touched my heart. The second one I will talk about is it's sort of a 50-50. In our local, my Navajo Nation, we call Soy Medical Center, we have something called the Golden Ticket. And so what that is that if you don't have an appointment, but you want to get HIV testing, you want to get STD testing, you fill out a golden ticket. You go up front, you just ask them, "Can I have a golden ticket?" And they'll give it to you. You fill out what you need. The person then doesn't announce what you're there for. They look at it, they see exactly what you want, and they really fast track you through so that you're being seen that day or within the hour. And so that's really beautiful. And it touches me because I have a friend in Zuni, which is about 75 miles away. And it's a smaller community. They do have a health clinic there, but he didn't want to be seen. He thought maybe he didn't know what was going on. He just knew he wasn't feeling right. He drove all the way here. I told him, "You can be seen here. Ask for a golden ticket. They will take you in. No one will know what's going on. Nobody knows you except me, you know." And
Right,
so he
right.
did it, and they were able to get him in and be seen. And um, it talks about, even something simple as a golden ticket in any of our clinics allows the freedom to be able um, to go in. So I was lucky that I was able to advise him to say, "Hey, come on in. We'll take
Yeah.
care of you." And he was like, "Oh my God, thank you." So
It's
I'm glad.
so important to have that person who is the liaison. Like you're serving as this liaison between people and care. You're not necessarily a direct health care service provider like a doctor or a nurse,
Right.
but in a lot of ways serving that role is exactly as crucial. Just making knowing what to say to make people feel safe and feel safe enough to get themselves, the care that they need. So that's really, really dope.
Cool, cool. Yes.
And we have just one more question. How can, well, maybe I'll break this one down into two. It says, how can individuals participate in National Native HIV/AIDS Awareness Day and beyond just this day? I guess you could break it down to, people in the community and people outside of the community, whether that's the Native community or people living with HIV, both. So, what do you think?
You know what? I think really the thing is that to be aware, and I know it's easier said than done. It's very easier said than done, but to be aware that, and this is one thing I always tell in my trainings, there are Native people everywhere in every state. We even have some in Guam. We're there. We're hidden in the sense that, maybe we look like the local populations, or we make assumptions that, oh, this person must be Spanish, they may be Mexican. Um, and so just to be aware and to know that we are everywhere. We are in the urban areas. In Seattle, we're definitely represented there. Um, and so to take that extra step to ask, and on this special day, this first day of spring, is to, be awakened to new possibilities, to be awakened that we are so diverse. All of us here are so diverse, to make sure that we don't make assumptions. And I know in a medical environment, things move very quickly, but sometimes we need to step back, take a deep breath, and like, okay, what's going on here? And we as people feel when there's a true questioning being asked. It's like, oh, I just want to make an assumption, but are you Native American, or are you Native person, Indigenous? And like, oh yes, I am. Okay, I just want to make sure and explain why this is important. That would be the first one. And then also on our side as Native people, to be able to talk about it, to be able to talk about HIV, and to be aware it is not a white gay man's disease. It is, we're all humans. What HIV stands for, we are all HIV possible. And so one of still the greatest barriers is that when I will hear disparaging comments outside my door, um, I step up and say, look, we are all human. Do you know how HIV works? Well, let me sit down. Let me give you my 5 minute spiel, and we're going to talk about it. And then you understand. Because I said, you never know, you don't know. And one thing I always say is, whether you're in the medical environment, whatever, everybody, we don't know if when somebody is positive or not. So therefore, because we all don't know each other's stories, we need to just be aware. And if we can talk about that and talk about HIV in Native communities, we'll be all right. It's about heart.
It's about heart. I love it. I love it, Chris. Well, before we go, maybe could you shed a little light on the upcoming plenary at the summit and what that's going to be like and how that's going to sort of continue this conversation we're opening today?
Well, besides the fact that I'll be there, we have
Absolutely.
we'll have two great speakers from Alaska. They're doing some great things around telemedicine, as well as I Know Mine, which is about using salmon as a cultural icon to break down and talk about HIV or any type of health disparities in your community. And I want the focus on them and how they're doing that in a very rural area and also in urban areas. And the plenary will actually talk about and let Native people be seen by a largely non-Native audience
So
to
important.
understand, yeah, to understand that we have lessons we can share too. We want to talk about these lessons and let biomedical really be a place where we can talk about it and talk about stigma, because there's so many people who have all this information on biomedical, but how do we get that past the door of stigma, that barrier of stigma, so we can actually talk about PrEP and talk about testing and talk about, you know, healthier lives and heart.
Absolutely. Well, wow. Thank you so much for this great introductory chat. I hope that everybody who's viewing will be able to join us at the summit and keep the conversation going, open up new parts of the conversation. Yes, fingers crossed. We would love to see you in Seattle. And yeah, thank you again for tuning in. Thank you so much, Chris, for your time today and for sharing that
Always,
information with us.
always 1 month away from today, 1 month
A
away.
month away, April 19th and 20th in Seattle, Washington. We hope to see you all there. Y'all have a
Thank you
good
all
one.
much. Thank you.